Okay, welcome back. In this video, we'll discuss chapter number 4 in our medical terminology video series. In this chapter, we'll cover the human body in health and disease. Learning objectives for this chapter: define and spell the word parts used to create terms for the human body. Identify the building blocks and organ systems and the cavities of the body. Identify the anatomical planes, regions, and directional terms used to describe areas of the body. Break down and define the important terms associated with the anatomy and physiology of the human body. Define the introductory terms associated with medical terminology. And lastly, identify the 5 major diagnostic imaging procedures. Alright, the human body in health and disease. Now, the study of medical terminology includes studying the body at a healthy state. And by doing so, you can better understand the mechanisms of disease. So by focusing on what the body should be doing and what is accepted to be normal, it's easier to pick out what is not normal and when something is going wrong. And the study of medical terminology also includes the study of how the body is organized and how the body parts function. Right, we'll go over some very common terms that you'll find in reference to the human body. Abdomen or abdomino is a reference to the abdomen. Anter or antero is a reference to anterior or toward the front. Brachii is a reference to the arm. Cardi or cardio is a reference to the heart. Caud or caudo is a reference to the tail or the tail end. Cephalo is a reference to the head. So again, all these are the root words. All of these are the root words, and then with the combining vowel after it. So it's rare that you'll see cephal, you'll see cephalo, you'll see caudo, cardio, and so on. Cervic or cervico is a reference to the neck or the neck of a structure. So not just your neck where your head is found, also the cervix. In a woman, for example, forms a small neck of the uterus. A chondri is a reference to cartilage. Crano or cranio is a reference to the cranium. Site or cyto, reference to cell. Dist or disto means far or distant. Dors or dorso means toward the back, such as dorsal. Femero or femor, reference to the femoral region, the thigh region. Gastro is a reference to the stomach. Glute is a reference to the buttocks, so your gluteus maximus is the biggest muscle in the buttocks. Homo or homeo means the same. So a homosexual couple are 2 people of the same sex, so 2 men or 2 women. A heterosexual couple would be a male and a female, 2 different sexes. The last one on the slide, ili, is a reference to the ilium, which is one of the bones of the pelvis. Inferior or infero is a reference to inferior or below. Inguine or inguino is a reference to the groin, where you'll find the inguinal canal in males. Latero is a reference to the side, such as in American football, a lateral is pitching the football to the side, not forward, not backwards, but directly to the side. Lum or lumbo is a reference to the lower back. Medio is a reference toward the middle. The organo or organ is a reference to an organ in general. Pelv or pelvo is a reference to the pelvis. Physio is a reference to nature or function, more specifically the function, and we'll talk about that here in a few minutes when we compare anatomy versus physiology. Pleuro is a reference to the pleura, which are a set of 2 membranes that cover the lungs and the thoracic cage. Postero is a reference toward the back. This would be the opposite of anterior. So anterior is toward the front, posterior is toward the back. Proxim or proximo is close by, so think of this as being in proximity. This would be the opposite of distal. Distal would mean distant or further away. Proximo or proxim would mean close by. Super or superio would mean above or higher than. Thoraco or thoraco. Thoraco would mean the thorax, the thoracic cavity. Tom or tomo or tomo means to cut. The umbilic or umbilico is a reference to the umbilical region, so where your belly button is found. And the last one on the slide, ventro, means the belly side of the body. So for humans, this would also mean anterior. This would be the opposite of dorsal. All right, now we'll talk about anatomy and physiology. A lot of people will use these terms interchangeably, but they do not mean the same thing at all. They are related, of course, but they mean 2 very different things. When you talk about anatomy, you're talking about the structure of an item. The physiology is how it functions. So these will be related, obviously, because the structure of an organ, of a cell, of a whole body system will influence how well it functions. So anatomy means structure, physiology means function. and these both will have a role with homeostasis. Homeostasis is maintaining a stable internal environment, not only in a cell, but in an overall person. So if something is not structured correctly, say if there's an injury or there's some disease interferes with its structure, that will interfere with its function. That will interfere with the ability to maintain homeostasis. For example, if the kidneys are blocked through kidney stones or from some kind of injury, then they don't work as well. They can't filter blood and make urine as well as it should. That physical structural damage will influence its overall function. It will function more poorly, and that poor function will lead to a less stable internal environment, a less than normal homeostasis. Now we'll talk about the building blocks of the body structure. The most simple form, the basic building block of the human body is the cell. And cells can vary in shape and size and structure and function. These are the basic units of the human body, are the cells. You get several cells that are working together with a common function. They will form tissues. You have several tissues working together with a common function, then you form an organ. Like the brain, like the heart, like the liver. Those are organs. You get several organs working together with a common function, then you have a body system. Cardiovascular system, respiratory system, nervous system. They're made up of multiple organs, but with a common goal, a common function. Basic building block of all matter, not just of human bodies, but of all matter that exists, is the atom. From there, the more advanced you get, as atoms combine, they will form molecules, forming sugars and proteins and water. Then you have organelles, the functional units within cells that have a particular job, like the nucleus, like the mitochondria. Then the next level of organization, you get cells. Many kinds of cells working together, you get tissues. And all material in your body falls into one of four categories of tissues. It's either going to be epithelial tissue, connective tissue, muscle tissue, or nervous tissue. So everything in your body falls into one of those four different categories. The broadest category of these four is connective tissue. That includes things such as bone in your skeleton, blood, different types of cartilage. This covers a very wide range of different types of tissues. Okay, when you get different tissues working together, you get organs, and these will maintain a certain shape about them. The kidney has a particular shape to it, and the heart has a particular shape to it. And all organs have a general function. Your heart does a function that the kidneys don't do, or the liver doesn't do, and vice versa. The heart has a particular job. The brain has a general job. The liver has a general job that other organs don't do. And some examples are listed here: the stomach, brain, pancreas, skin, so on. Then we get certain organs working together. You get organ systems. The body has 11 body systems, and each system will perform a general function. Breaking down food so your body can use that energy. Getting rid of carbon dioxide as waste. Pumping blood through various tissues of the body. And we'll talk about each of those 11 systems briefly next. All right, the first one, the cardiovascular system. The major organs, of course, the arteries, veins, heart, and of course, the general function, transport substances both to and from body cells. You want to deliver oxygen to the cells, but also pick up carbon dioxide to get rid of it. All right, the next body system, lymphatic. This would include things such as the tonsils, thymus, various lymphatic vessels, lymph nodes, spleen. And the general function of this system is to remove unwanted substances and recycle fluid to the blood. Respiratory system. Major organs here would include the trachea and the lungs, the bronchi, the larynx, the nose, the pharynx. And the general function for this system to exchange gases between the external environment and the internal environment, such as the blood and the cell. It's basically taking in oxygen and getting rid of carbon dioxide. The next system, the digestive system, is to include the esophagus and the stomach and the intestines, the liver, gallbladder, the mouth. And the general function for here is to prepare foods for absorption into the bloodstream, and also to eliminate the solid waste that your body doesn't want or doesn't need. Urinary system. This would include the kidneys and the ureters and the urinary bladder and then the urethra. And the function here is to remove nitrogenous waste and also to remove excess water and salts from the bloodstream. The reproductive system for females, this would include the mammary glands, fallopian tubes, uterus, ovaries, and vagina. General function is to provide the creation of new individuals. And for the male reproductive system, major organs would include the penis, testes, the prostate, urethra, and various other glands. Of course, general function is like for the female to provide for the creation of new individual. Nervous system, of course, the brain and the spinal cord, various nerves. Function here is to control homeostasis by sensing changes in the environment, being able to process information, and then initiating your body's response to those changes. The endocrine system, major organs we find here, pituitary gland, the thymus, thyroid, adrenals, pancreas, ovaries for the females, testes for the males, and their general function is to control homeostasis by releasing hormones into the bloodstream, which will alter body functions greatly. The musculoskeletal system, this includes both the bones, various types of joints, various types of cartilages, and also the muscles. That's why you get musculoskeletal, the muscles and skeleton. The muscles will provide movement for the body parts, and then the bones and the joints will support the body and also protect the internal organs, and also serve as a site of attachment for muscles. Muscles can't work if they're not attached to something. There's some other functions for the system, being able to store minerals and also form blood cells. All blood cells are formed within the skeletal system. Integumentary system, this will include the hair and the skin and the nails and everything associated with the skin. A general function here, protect the body from fluid loss and injury and infection. All right, now we'll talk about some directional terms when it comes to the human body. Now, most directional terms will include one word root and usually one suffix. And that suffix is usually the ending al or ior, like superior, posterior, distal, proximal, medial, and so on. And all these terms are based on a very standard starting position called anatomical position. If you think of all these scientists all over the world who speak countless numbers of languages, you can't have superior meaning something in English and it means something different in Italian or German or Japanese. So there's a standard agreed upon starting point that all these terms are based off of, and that's called anatomical position. And that includes standing up straight, facing forward, your hands by your side, with your palms facing outward, and your feet about shoulder length apart. It's from that point where all directional terms in anatomy are based off of. Alright, some word roots that involve direction. Super or superior would mean above. The opposite of that would be inferior, or such as inferior, which would mean below. Anterior or anterior would mean toward the front. Posterior or posterior would mean toward the back. Midi or medial would mean toward the middle. It's important to remember that these terms, such as super and infer, are going to be relationship based. And what I mean by that is you can have a body part be both superior and inferior at the same time. It just depends what you are comparing it to. If, for example, your chin is inferior to your nose, is below your nose, but is superior or above, say, your hip. It's based on what you are comparing it to. What is it higher than? What is it lower than? Later or lateral would mean toward the side. Proxim or proximal would mean close by. The opposite of that, distal or distal would mean further away. And these two terms are usually in reference to the chest or to the trunk, or the point of attachment. So, for example, your elbow is closer to your chest than your fingers are. So your elbow would be proximal to the chest. Your fingers would be distal to the chest. The ventral, venter, would be on the belly side of the body. The ventral is another term for anterior. We talk about humans. Dors or dorsal is another word for the back. So you can use dorsal or posterior because they are interchangeable. Then caud or caudal would mean toward the tail end. Here are those word roots with the most common suffix ending you'll find with them. Superior, inferior, anterior, or ventral. Those are the same. Those reference the same direction, toward the front. Posterior or dorsal. Those are also interchangeable terms. They mean the same thing, toward the back. Medial, toward the middle. Lateral, superficial, closer to the surface. Deep, more internal. So a superficial cut is not that big a deal. A deep cut is a big deal because it's getting more internal into the body. Proximal and distal. Proximal means close by. Distal means further away. All right, now we'll talk about the various imaginary planes that will divide the body. And this helps to dissect the body into various regions. There are three main planes that are used, and each has more than one term that you'll see used to describe them. The first one, frontal or coronal plane. This will divide the body into a front portion and a back portion. And the term coronal means crown. So if you can think of wearing a tiara or wearing a headband, how it goes across from ear to ear on top of your head. So if that were to divide the body straight down, the front part of your body would fall forward, and the back part of your body would fall backward. So that's a frontal plane, or the coronal. Sagittal plane, this will divide the body right down the middle of the chest, so you have an equal right and left half of the body. And then the transverse plane, this will cut the body into an upper portion and a lower portion. So think of where your belt is on your pants. So if that were to cut you in half, the upper portion and then the lower portion. And here are examples of all three of those. Coronal or frontal plane is dividing you this way. So this part of this figure would fall forward, and the back part of her would fall backward. Mid-sagittal or the sagittal plane, that's usually referenced, cutting you right down the middle. So there's an equal right and left half of the body. Then the transverse or the horizontal plane, cutting you into an equal upper portion and lower portion. All right, now I'll talk about various regions of the body, and such as the head and the neck, the upper appendages, the arms, the trunk, which is another term for the chest, and then the lower appendages. Now, some regions are so complex they are further broken down themselves into other types of regions. A good example of that would be the abdomen. And the abdomen is broken down into two separate ways. It's broken down into quadrants, also broken down into regions. And the reason why this is important is you can't just say when you go to the doctor, well, my abdomen hurts. Well, that could mean anything. It could mean something with your stomach. It could mean your appendix. Being able to focus exactly where in your abdomen that you're having pain will help you get treatment faster. The abdominal regions, you can think of this as cutting your abdomen into a tic-tac-toe pattern, where you have 9 squares, a top row, middle row, and a bottom row. You have the epigastric region, hypochondriac regions, left and right, and the iliac regions, right and left, lumbar regions, right and left, the umbilical region, which would be where your belly button is. That would be the center square in our tic-tac-toe pattern, and then also the hypogastric region. So I'll focus on these first. These are all the terms we just went over. Again, this is where knowing where these prefixes and suffixes, knowing their definition will help out greatly. So umbilical means the belly button, so you can start off here. Epi means above, gastric means stomach, so the epigastric region would be right above that. Hypo means lower than, so hypogastric would be below that. Then you have the hypochondriacs here and here. The lumbars here and here, because that's your lower back. Then the iliacs here and here, because those correspond to the ilium region of your pelvis. And the one thing you'll notice on this, everything on this side of the image is left. Left hypochondriac, left lumbar, left iliac. Everything on here is right. Right hypochondriac, right lumbar, right iliac. And something that is very common for students in the beginning of anatomy physiology is to get those two directional terms wrong. When you're looking at this, it's not about the image, it's not about you, the observer, it's about the patient. So for example, this would be the patient's left arm. Even though it's on the right hand side of the image, it's not about you, it's about the patient, it's about them. So everything on this side of this person is left. Everything on this side is right. It's all because of anatomical position. And knowing which side is which is important if you were to have, say, your left kidney removed. You want to make sure that the doctor knows which side to take out. And a good comparison for these types of terms is for performers or actors or dancers on a stage. Stage right and stage left are going to be different to the audience. So if you are on stage and move to your right, that's going to be to the audience's left. So it's the same principle there. That's how the abdomen is divided into regions. You can also divide the abdomen into quadrants. And quad means 4, so there are only 4 quadrants. You have 2 uppers, right upper, left upper, and then 2 lower quadrants, right lower, left lower. And again, everything on this side is left, everything on this side is right. And most people define remembering upper versus lower, but where people sometimes get confused is right versus left. And the quadrants have abbreviations that can be used, so you don't have to write out the full name. You can abbreviate the right upper quadrant by putting RUQ, or left upper quadrant LUQ, right lower quadrant RLQ, and left lower LLQ. And again, these regions we just talked about, these 9 regions, these 4 quadrants, are only in reference to the abdomen. Not any other region of the body, just the abdomen, because the abdomen has so many organs, so many structures all crammed into one area. Alright, some other anatomical terms. Of course, the body as a whole, you have the central trunk or the torso, your appendages, which include the arms and legs, various cavities, and the viscera. Alright, we'll talk about the body cavities first. The first group we'll talk about are the dorsal cavities. Dorsal means toward the back. So these are the cavities that are toward the back of your body when put in the standard anatomical position. And there are two dorsal cavities: the cranial cavity, where you'll find the brain, and the spinal cavity, or the vertebral cavity, where you find the spinal cord. The brain and the spinal cord. So everything in this reddish color would be the dorsal cavities, and everything in this purplish color would be the anterior cavities, which we'll talk about next. See, the ventral cavity, or the anterior cavities. You have the thoracic cavity, which is where you find the heart and the lungs. Pericardial cavities, where you'll find the heart actually wrapped in a membrane. The pleural cavities, where you'll find the lungs. And a cavity in between those is called the mediastinum, where you find some of the larger vessels of the heart. Now, this thoracic cavity is separated from the abdominal cavity by the diaphragm, a very large muscle that is the primary muscle used in the process of breathing. Alright, below the thoracic cavity, below the diaphragm, you have the abdominal cavity and also the pelvic cavity. And sometimes you'll see these grouped together as the abdominal pelvic cavity, but they are two separate cavities. They are two separate items. So you have the abdominal cavity, which we talked about earlier, the 9 regions and the 4 quadrants. This is where you'll find a huge number of organs: the intestines, stomach, liver, gallbladder, spleen, kidney. And the pelvic cavity is where you'll find the internal reproductive organs, and also the urinary bladder. Alright, so going back to this image, the ones that are in purple are the ventral cavities, or the anterior cavities. Thoracic cavity here, where you find the heart and lungs. Then you have separated by the diaphragm here. Then you have the abdominal cavity here. And just below that, you have the pelvic cavity. So these 3 main cavities are in the front, and then these 2 are in the back. Alright, now we'll go over some basic medical terms of the human body. The first one, disease. This is a condition where the body isn't working normally. This could be anything from something very, very minor to something very serious. Pathology is the study of disease. Patho means disease, and logi means the study of, so the study of disease. A pathologist is a person that studies disease. Diagnosis, this is identifying what the symptoms are, what is making someone sick. And symptoms, these are indicators of a disease. And of course, this covers a wide variety of severity. The term sign. A sign is also an indicator of a disease, like a symptom, but they are different in some important ways. A symptom is subjective, and a sign is not. It's objective. So, for example, I feel dizzy. I feel hungry. Those are things that you can't measure as a medical professional. You're relying on the patient's ability to describe how they're feeling. So it is very subjective. A sign is something that can be measured. You can measure a fever. You can measure white blood cell count. You can measure if there's blood in stool, for example. Those are things that are objective. You can easily measure those. Symptoms are not. They are subjective. Next two, acute and chronic. Acute means something that happens very suddenly, very rapidly, and chronic is something very long-term. All right, the next term, infection or infectious disease. This is the invasion and the multiplication of a microorganism, such as a virus or a fungal spore or a bacterium. Trauma is a general term for either emotional or physical injury. And the last one on here, prognosis. This is a forecast for a possible outcome of treatment. Now we'll talk about different types of diagnostic imaging. There are 5 main types: endoscopy, CT scan, commonly called a CAT scan, PET scan, MRI, and ultrasound. The first one, endoscopy. This will view the internal anatomy on a monitor. It may also include some surgical attachments that will allow the physician to manipulate internal body parts while viewing through the monitor, usually with a camera or with a light on the end of a tube. And for example, is a procedure that's not very invasive at all. All you're doing is adding a very small incision where you can put the scope into the body. So you'll have a very long tube with a camera and usually a light on the far end, and an image can be seen on the monitor here. This can be used to identify ulcers or surgically remove polyps, for example. A CAT scan or CT scan, computed tomography scanning, what the CT stands for. This can scan from multiple angles all at the same time. It is useful when you're trying to view a cross-sectional image of organs. And this is a pretty standard evaluation used for trauma in most body areas. And here's how this would look. This patient going through a CT scan right here. The PET scan, positron emission tomography. This is where you have a radioactive substance that is combined with a metabolically active or important material that is then injected into the patient or inhaled by the patient. And the reason why this is done is the metabolic activity of an organ will be highlighted more by that radioactive substance. And this higher level of activity will be detected by the PET scan as the radioactive particles are being released by that organ. And this is how this machine would look, a PET scan. Patient would lie down here and they would be rolled into this area here, and this will spin all the way around them multiple times. Okay, here's an example of how a PET scan would look. And for an image like this, wherever you see bright colors like red, those are areas that are metabolically active. And other colors like blue and white and gray are not active. So this is a very good tool to use to diagnose cancer, because there are some parts of the body that should not be metabolically active. So for example, this area here should not be, but it's bright red because of the radioactive material that's been injected into the patient. So the higher level of metabolic activity is an indicator that there's other living tissue there, because all tissues still need to use metabolism. Even cancer cells, even though they are immature and inactive cells, still need oxygen. They still need to get nutrients. They still need to break down stuff so they can still survive. So they have their own metabolism. So that's when a PET scan is used. See, next one, MRIs. Magnetic resonance imaging. This type of scanning technique will offer the clearest, most complete images of the internal anatomy. This will contain magnets, very strong magnets, that will respond to hydrogen atoms in the body by sending a signal to a computer, and that computer will analyze that information. MRI is used to diagnose multiple types of cancers and joint disease and traumas. But the problem with MRIs is, because you're using magnets, many people can't even undergo this imaging technique. People who have defibrillators or pacemakers or metal joint replacements can't go anywhere near this kind of machine because it's a really big magnet. So even though it would help them to go through this kind of technique to be able to diagnose other conditions, they can't get near this kind of machine because the magnet would just destroy their defibrillator or destroy their pacemaker. Here's how our MRI would look. Of course, the patient laying down, going through a circular donut-shaped scanner. The ultrasound imaging, also called sonography. Here you use a pulsation of harmless sound waves that go through the body. Now, ultra means in excess of or beyond than sound. So you're using sound waves, but they are beyond the frequency that we can hear with our own ears. So these waves will produce echoes that can be detected by a probe then interpreted on a computer. This is very useful in prenatal care by providing an early glimpse of the fetus as it develops. There are some body systems where an ultrasound would be used for diagnostics, obstetrics and gynecology, for fetal development, checking for either uterine or breast or ovarian cancers. It's used in cardiology. It's often called an echocardiogram, where you're able to watch the flow of blood within the heart and also through various blood vessels. Also used in urology, where you're checking the blood flow through the kidneys, also to check for prostate cancers in males, and also for seeing any kind of blockages such as kidney stones. Pretty common image of an ultrasound. We're able to view the image of the developing fetus here on the screen. Alright, we'll end our video with our short quiz on the combining forms and their definitions. The 5 on the left are the root words, and then the definitions are on the right. It's either going to be dorso, antero, proximo, supero, infero. They can mean either front, below, back, above, or near. The first one, dorso, would mean back, like dorsal. Antero means the front, like anterior. Proximo, near, like proximal. Supero, above, like superior. And the opposite of that, infero, would mean below, like inferior. And here are the answers to these 5 very common, very basic combining forms. And that will bring us to the end of our video for chapter number 4. And we will continue our series on medical terminology in our next video on chapter number 5.